Hey all, my name is Angelica Rubio, State Representative for District 35, serving the City of Las Cruces, and this is a brief legislative update. It is Saturday, February 8th. I just got back from being in committee all morning long. We had Consumer and Public Affairs Committee, and for those of you who don't know, that's where we hear a lot of really controversial bills. So we're hearing a lot of bills around public safety, tough on crime bills, you name it. And I am the vice chair of that committee. And today we were hearing bills from a Republican who carries a lot of these public safety, tough on crime bills. And needless to say, it was a rough day. I say rough because I really do think that this Republican does come in good faith in terms of trying to figure out what to do in terms of dealing with a lot of the public safety issues that the state is facing at the moment. And because she serves in a very rural area, I think she tries to take that balance of what people in rural New Mexico are facing and versus what we're constantly hearing about being in Albuquerque and Santa Fe and Las Cruces. With that said, today we heard a couple bills, and the last one was really hard because it's related to fentanyl. And as many of you know, fentanyl has been an incredible burden not only to society itself, it's horrifying the things that are what fentanyl leads to in terms of consequences for society, but just in terms of addiction and families and how they're being impacted. Today we heard from a number of people who are directly impacted by fentanyl and fentanyl deaths, and I mean, what do you say to that? It's hard. I get it. I get how rough the issue is, and my heart goes out to the folks who are struggling with family being addicted and dying because of fentanyl use. I just want to take a moment though to talk about the rise of fentanyl, because it wasn't by accident. We're now having to figure this issue out, but it didn't happen by accident. Fentanyl is a major public health issue, and that's in the way that we should be looking at it. And it's deeply connected to the history that the United States has with opioid addiction. So in the 90s and in the 2000s, we had what's called Oxycontin, and it was being prescribed to a lot of people back in the day. Doctors were prescribing it as painkillers for people to use as after surgeries and things like that. And many of these patients became heavily addicted. And so when the government decided to crack down on this opioid addiction and looking for other alternatives, there was an increase in trying to figure out about other potent types of drugs, what could be just as good as Oxycontin. And fentanyl was created, and it's a synthetic drug. And so you can find fentanyl mixed in with other things, which is what has been so challenging for communities, is that fentanyl isn't just something that you can just sort of just find. It's mixed in so many different things. So when people got off of Oxycontin, they went towards heroin, for example, to help with their pain, with their pain and with their addiction. And now fentanyl's become sort of this drug that people who were addicted to heroin, now it's fentanyl. And fentanyl is extremely more potent than what heroin is. By that I just mean it's just way stronger. And because it's so much stronger, we're seeing so many overdoses all around the state, all around the country. And so it's huge. I think that one of the things that was talked about today in committee is that Over half of overdoses right now throughout the state of New Mexico are related to fentanyl overdose. And so the drug is scary, and it's also very, very inexpensive. So people who are addicted to it have access to it pretty easily in comparison to other drugs that we have had in the past. The reason today was so hard, though, is because part of how policymakers are looking at the issue right now, and folks in law enforcement and just families who are just ready to do something about this, is that they're looking at criminalizing people who use fentanyl, or tackling like the cartels or dealers who deal fentanyl. So one of the last bills that we heard was including fentanyl, adding the term exposure to fentanyl as abuse if it's discovered within or near a child, and it would be considered like child abuse. Now, we can have this huge argument around whether or not that is like yes, it should be child abuse if there's a child near or around fentanyl. But the way that the bill was brought to us today, to me, was just very problematic, and I didn't support it. We ended up tabling the bill. But the reason that I bring it up is because we as a country have had a very, very long history of a war on drugs, and how we have straight up incarcerated millions of people all around the country because of their use of said drugs. But we have yet to invest in people, in their in treating their addiction, in dealing with issues related to generational poverty that sometimes leads to addiction. And those are long-term goals that we should be setting, but because politics is involved and communities are struggling right now with crime because of this fentanyl use, everybody wants a quick fix, and they always think that the quick fix is incarceration. I don't believe that. I will never believe that. And I just want to make it clear that as long as I serve in these committees, and as long as I'm serving in the legislature, for me, I think what's critical is that we invest in programs that support people to be able to get rid of this addiction versus throwing them in jail, and letting that incarceration then like lead to other consequences, like broken families, loss of jobs, there's so many different, there's all these consequences that come with incarcerating somebody who's addicted rather than just treating the addiction. A lot of you all may not agree with that, and I get it. I'm not here to try to convince you otherwise. I think it's just important to provide some context that historically in this country, rather than dealing with the addiction itself, what we've done is we've criminalized it, and we've criminalized it in the past. We saw it in the 80s under Ronald Reagan, and we're starting to see it again. And it's important for me to inform you all, because I think this is what we're starting to see here in the legislature, is that we have a majority in the Democratic House and Senate and the governor's office. And rather than working towards treating people with addiction, we're moving to the right. That has proven time and time again that doesn't work, and all because of politics. And that to me is very, very frustrating. So if you live in New Mexico and you are interested and concerned about these issues, I urge you, please, to contact your legislators and urge them that we need to put money into treatment and treatment of addiction, and not this idea of mass incarcerating people who are deeply, deeply hurting over their addiction, and And that's my call to action to you all today. Thanks. Peace out. Be safe.